Welcome back to part 3 of your notes, part 3 of the respiratory system. This is the final part as well, where we've been covering some disorders, diseases, just injuries, things like that. Some of these you've probably heard before, and maybe you don't understand the full context of them or how they get them, but I just wanted to go over a few of them. So bronchitis, remember itis is, of course, inflammation. So inflammation of the bronchi, remember the bronchi are the two places that the trachea splits off into the two lungs. Trachea is windpipe, and then bronchi, shoop, into the two lungs. This is when those membranes of the bronchi, the larger bronchial tubes, get inflamed. And also what happens in that with this inflammation is a lot of mucus. So somebody with bronchitis is going to be coughing a lot. Trying to clear out these passageways, trying to force air, out of these tubes and come out. So you're going to get this persistent cough. It's also going to be a fairly wet cough. You've probably heard the difference in a wet cough and a dry cough. It sounds like there's some moisture in there. So you see that. Now, bronchitis can be caused by a number of things. Bacterial, viral infection. Sometimes it can, come from other diseases, certain things like that. Then we have bronchiolitis. Bronchiolitis is the inflammation of the bronchioles. Remember, those are like how it's a tree branch. The bronchi are the larger branches, and then the smaller branches are bronchioles. This one is primarily caused by viruses. And we also see this mainly in young children, infants, even newborns. So bronchiolitis. Very rarely will young adult or adult get this. Typically, the bronchitis sets up, it fills up, and we have enough lung capacity to push out any of the mucus that's there, and our body is, typically got a better immune system as well. So those bronchioles are salvaged; they don't get the disease or the infection, that the younger people may have. There we go. Emphysema. You've probably heard of this. Now, a lot of people look at emphysema as a disease of older people, but not always the case. It's progressive degenerative disease. That means it's going to get worse, okay? And it's also going to take a longer period of time to get there. Progressive meaning taking a long period, degenerative, breaking down over time, disease. And what it affects is those alveoli. More specifically, the walls of the alveoli. So we got the alveoli. Remember, those are these sacs where air exchange or gas exchange occurs in the lungs. This is where respiration really happens. Emphysema causes these sacs to get larger. It reduces the area of the surface. So if there's more of them, there's more places for the air to pass from here out into the bloodstream. We start losing some of those alveoli, or the definition of those alveoli. Less area for air to pass in between the two. So less oxygen in our body because it's having a harder time getting there. Now, emphysema, you oftentimes hear this with long-term smokers, and that is a very common place for it to occur, or why it occurs. Somebody that smokes long-term. I said not always old people, because some people may be exposed to smoking or polluted air earlier on in life. So there is emphysema that's early onset, that happens earlier in life. Breathing polluted air is we oftentimes want to jump on smokers' backs about things, and in no way, shape, form, or fashion do I really promote smoking tobacco of any kind because of how it impacts your lungs. But oftentimes we forget about breathing polluted air. So living in cities with poor air quality, especially these larger cities, places like Los Angeles, we have higher cases of emphysema. Around the world. Now, we don't always get good statistics from China because of their infrastructure politically, but the data that we do get shows that there's more emphysema in places like Beijing, where air quality is not really considered to be the greatest in the world. And we also see certain professions where you have breathing polluted air quality for a long time, like coal miners. You might have heard of the black lung. That was emphysema. If you ever watched the movie Zoolander, Derek Zoolander's like, I got the black lung pop. It's a really good movie. Anyway, one day being down in the mines. And that's not the case, but people that have worked in that environment, they have more likely to get emphysema. Anywhere there's smoke, factory type settings, or even where there's pollutants in the air that may not be smoke, So like manufacturing is a huge one where you see more uptick in emphysema. So, the black lung is kind of a definition or a nickname for it, excuse me, because your lung really does deteriorate and turn black. Here's a great picture of it. Healthy human lung, obviously not super healthy because it's out of a person, but you see some black spotting. That's very typical. I mentioned that I think in part 1 video. We breathe in, things that aren't healthy for our lung. Our lung takes a lot of damage. It's a very sensitive organ. But this is still healthy. And this is somebody that's probably later on in life when they expired. I would guess, 60s, 70s based on where they lived and what they interacted with. Emphysema over here, you see the stark difference, right? Somebody with emphysema, the alveolar walls start breaking down. Pneumonia. Pneumonia is a very common illness. Millions of Americans every year. This is caused by an infection. Could be a number of things. You can read those on your screen there. Lots of different organisms can cause it. You see pneumonia, people developing pneumonia after they've had something else. The hospital is a big place for you to develop pneumonia, especially in people. Down here it talks about the severity, type of organism causes it, but also the age and underlying health of the patient or the individual. Somebody goes in the hospital with another illness or something going wrong, injury, and then they suddenly got pneumonia. Well, it's not that abnormal. Think about who comes in the hospital. People that have illnesses, people that carry illnesses, even some of the workers there that, they may not have a certain illness, but they're still kind of carrying it on their body in their respiratory system. So it passes on. So if you're there in a weakened state, very easy for you to contract that. So that's how you hear about, Mama went to the hospital for a hip surgery, but man, now she's got pneumonia in both lungs and she's, fighting for her life. As sad as that situation is, it's certainly not uncommon and shouldn't be not expected because the pneumonia, it's an infection caused by a number of things. We can be exposed to those things and it can set up in our lungs. There's all kinds of symptoms that come with it. Cough, persistent cough. You can have fluid in your lungs. This type of infection. Pneumonia is kind of an umbrella term. There's different types of pneumonias, of course. Asthma, another thing that we don't, fully understand as common people. This is a chronic, meaning it's there over your lifetime. Inflammatory lung disease. Airways getting tightened up or, get smaller, get restricted. We can see this is a great diagram. Normal, healthy airway, lots of room in the bronchioles, plenty of room. This is where it's looking at. Coming up, air coming in and out. Some types of asthma, it's just kind of inflammation here. We see a smaller part of the tube there. The lumen there is closed up. And then with severe, we may have mucus. We see severely inflamed. Asthma can take different shapes according to the people. Some people have very light asthma. They can get back to a normal, healthy place just by controlling their breathing or stopping the activity that they're doing. But some need the puffer, right? And that puffer actually has medication in it that causes these airways to open back up. So you might see somebody with an asthma attack have to pull out their inhaler, their puffer, as I like to call it, to get from this area to just even this area and hopefully back to here. If they're exposed to certain irritants like smoke or dust, it can cause it to set up. Or if they do a lot of physical activity. I've had track athletes, and that's what they're doing is running. They're hopefully, going at a very high mark who have asthma. And it's just a matter of, hey, let's sit down and try to breathe normally. Let's restrict, let's get our breathing back to normal. Or you need to carry your puffer around with you and you need to make sure you start feeling your lungs getting tight. Is what they talk about. You need to just take a hit of your inhaler. So different forms of asthma. It's not a life-altering thing to some people, and some people it really inhibits the way that they live. Lung cancer, we hopefully know that cancer is simply uncontrolled cell growth. So the lung cancer is uncontrolled cell growth inside the lungs or different parts of the lungs, all the parts that we've learned in our diagram. And the main thing that happens there is abnormal cells that are uncontrollable are just robbing everything else of nutrients and oxygen. It kind of crowds it out. We can see that some tissues start to die. That kind of looks like necrosis, where tissue is dying there. So it's probably been dead for a while, caused by cancer. Smoking, is a huge thing, y'all, that causes lung cancer. We know it's a carcinogen. And just, not to get on a pedestal or nothing, I know I'm 10 minutes in, I'll have 5 minutes left. Vaping, we don't know. There's not enough studies. There's some websites I'm going to link that I encourage you to look at. People like to say it's a safe alternative to smoking. No, it's not. We do not know the data on it yet. We don't have a clue. So honestly, it's not worth the risk. Don't want to preach to you, but I want to see you alive and well in 30 years with families of your own. And, so don't do stupid things that really aren't going to matter in the long run. Pulmonary edema. This is edema means swelling. Edema means swelling. Edema means swelling. I say this because it might be on your exam tomorrow or next week. Excuse me. Not scary. Pulmonary means the lungs. So lung swelling. This is where fluid sets up in the air sacs of the lungs. Of course, when this fluid sets up near the alveoli, difficulty to breathe. You'll have wet coughs. Sounds like. This can come from a number of other things. So a lot of the diseases that we talked about, this is a symptom of it. Pulmonary edema, you'll hear that as a symptom of other things. Let me talk real quick about surfactant. Surfactant is a moisture that's on the surface of the alveoli. It simply causes everything to stay fluid, be able to stay moist. Sorry, Jenny. That keeps everything, breathing as you do. So when your lungs expand, these alveoli expand with it. It allows them to expand without any cracking or surface tension, feeling hardness in there. The reason I mentioned surfactant, there's something called respiratory distress syndrome. We see this in infants, newborns, where they don't produce enough surfactant. Now, what that leads to is hard time breathing. We see this especially in premature babies, so born before full term. They'll hear this grunting noise. That's a lot of times how we know this is happening. So if you're around a newborn, you hear this little grunt, or almost like a chicken type thing. It can be a good sign that they're not producing enough surfactant. Also, of course, if they're turning blue or a pale color and stop breathing, rapid breathing, it shows us that RDS. That child may have that. They may need to be monitored closely, put on, some oxygen, and helped out to make it through it. Just a couple pictures to show you. You can sit there and study those for a few minutes. A pneumothorax is a punctured lung. That's the official name for it there, a more medical term. This can happen when the pleural cavity that surrounds, remember the pleura, surrounds it, gets air inside of it. Now, this can cause from injuries, getting impacted, car accidents, sports accidents sometimes can cause that, or it can happen just from other types of infections. So we kind of see this pressure that sets up here, and when the air gets here, the lung collapses on this one side. Electrolysis, I can't pronounce that word very good. It's just when there's an inadequate gas exchange that causes it, not injury. But pneumothorax is what you really want to know on this slide. This is a picture, an x-ray of a collapsed lung. Here's a good, healthy lung. We can actually see some of the branches from the bronchi and bronchioles coming down through here. Here we just see this mass that's set up. So there's a clear difference. How to even see it on something, as elementary as an x-ray. How do we fix that? We intubate. We put a tube, through the chest. We drill it in there. We insert it into the pleural cavity, and we pull the oxygen out, or the air out, excuse me. Once that air comes out, pressure around the lung goes back to normal. It fills up and re-expands. Okay? So it is an invasive process. You got to put a hole in your body and into your pleural cavity. But it is a fairly good and effective fix. The most common respiratory infection is the common cold. It's one of those things that's been around for centuries, maybe millennia, that we haven't been able to get rid of. Thankfully, the symptoms are not super severe unless you have poor immune system. I wanted to mention a cough. Get away. A cough is a symptom of an illness, and it's our body's way of clearing dust and mucus out of the windpipe and lungs. We force that air up to try to clear those paths back. Coughs can be a symptom in a number of illnesses. In severe cases, when our windpipe shuts down, it tightens up. We might have to do something called a tracheotomy, also called a tracheostomy. Those are kind of interchangeable. There's a slight difference. This is drilling a hole in the neck in order to open it up. You've probably seen it on movies. Worth Googling real quick to see what it's about. This ends your notes.